How often your child goes to the loo is going to vary with their age, and they're going to be different to every other child. So, for instance, some kids, some babies, go to the loo several times a day. Some only go every few days. As long as they're happy with that and they're comfortable, that's not an issue. But being constipated is not pooing as often as usual for them, or poos that are hard or painful to pass, and they can vary from rabbit droppings to very, very large poos. Other symptoms include being off their food, soiling when they've been clean until now, complaining of tummy pain, being irritable, being generally out of sorts, and sometimes feeling sick or even being sick. Breastfed babies tend to poo more often, and that tends to change when you move on to solids, and again as you move on and become a toddler. So, if you have a very small child, a small baby, who has never had a normal stool pattern, or who's got a swollen tummy and a tender tummy, you should see the GP. You should also see the doctor if they're not putting on weight, or if the constipation starts when they introduce cow's milk into their diets, or if they have delay in their development or are otherwise unwell. Your health visitor can give you lots of advice on the right amount of fluid or fibre for your baby or your child if appropriate, and sometimes that's all that's needed. For slightly older children, a toileting schedule or a star chart can often help, but your doctor is probably going to be keener to start your child on a laxative at an early stage than they would if with an adult, purely because that can help prevent the child from being put off pooing in the longer term, which can cause all the more problems.